The 90-90 exercise and its many variations have been a staple in the rehab and mobility world for a long time. I wanted to go through today some of my favorite variants of that exercise. A lot of people are familiar with just kind of the general entry-level mobility aspect of the 90-90, which is phenomenal. I love it. But I also like to utilize this exercise for stability and motor control, and just to how it develops into more advanced motor patterns. Let's get into that today, so stay tuned. Hi, I'm Dr. Zach Ratliff of TruMotion Therapy. I'm a sports chiropractor here in Charlotte, North Carolina, where we specialize in the conservative management of musculoskeletal pain and injuries. That means we specialize in treatment without the use of drugs or surgical intervention. And we love getting people back doing the things they love and reaching the goals they have set before them. All right, so the typical variation of this exercise that most people are familiar with is you've got your arms propped up, you've got the feet pretty wide, and then you're gonna take the outside of one knee and the inside of the other knee, and then you're just gonna slowly work between that motion. This is great. It works all aspects of that hip as we're working here. But some things I like to get picky about, or things that you can add to this position, is the why behind some of this. So the hands behind us, big emphasis is so that we keep our spine tall. So oftentimes a lack of hip mobility, we're going to try and use the joints of our low back, our lumbar spine, in order to compensate. So when we keep our arms propped up, we're keeping that spine tall, and it's going to expose that hip and make this exercise isolate to the hip. So if I might not be able to get my knees fully to the ground when I don't have the ability to help fold through my spine. So the arms behind you are a nice little support to get familiar with this movement. The next progression I would take from this is being able to keep your spine upright without the use of your arms. So you can either have the arms out to the side or just kind of locked in, but you are keeping your spine nice and tall. And so then what you're gonna do is work back and forth here, utilizing core control in order to keep your spine tall, as well as mobilizing the hips at the same time. Other ways that you can add to this is when you're in this position, you can add in that forward fold, where again, we're gonna keep that spine tall, and then we're gonna almost try to take our belly button up and over that knee. So we don't necessarily wanna fold through that spine, but we wanna keep the spine in a nice organized pattern and leaning forward, again, making that workload go to the hip. So that's just one way we can add a little extra stretch. The other way we can add a little bit more control to this exercise is by slowing things down. So we're gonna keep this knee glued to the ground. I'm gonna lift this back knee as far as I possibly can. And when I feel like I can't go any further, then I'll allow that other side to come with it. And then same thing, I'm gonna lift that back leg as high as I can, and then let that back leg follow. And that can be a great way to slow down and expose some of the deficits in our mobility and our stability patterns. And then the 90-90 can become really fun too as we integrate it into other movement patterns. So what this can translate into is, as we're in this position, we're coming up into kind of that get up portion of it and work on controlling it back down, going through here. And the reason I like this variant is it mimics us getting up off the ground. So especially if you have kiddos or you're coming up off the ground with an object. So say I have this object, I can rotate, come up, and then come to that lunge position and work myself up. And vice versa, if I was holding a kiddo and I needed to get on the ground, I can slowly work into that progression back and forth there. So those are just a few of my favorite variants of the 90-90. Obviously the possibilities do end up a little bit limitless, but try those out and see what you think. I hope you found this content helpful. If you've enjoyed going through some of these progressions of that 90-90 exercise, feel free to check out our website at trumotiontherapy.com, where we have more information as well as the ability to schedule an appointment with one of our providers. And we can see if some of these exercises would be a good fit for addressing your functional goals as well as getting you out of pain and improving your range of motion.